the people, like you mentioned, the fourth trimester,
Yes.
after you have the baby, for women who are probably experiencing pain during sex, or like the things that we don't talk about in public and our poor husbands don't even know.
Right.
What then? Like, how to help? Like, how does that work with you?
Yeah. So the thing that I love about painless pregnancy is we come to see these women within the first 2 weeks of their delivery, and that can make all the difference. So when I was at the hospital, I used to see women on the mother-baby floor postpartum, and like a day postpartum, 6 hours postpartum, if she couldn't walk, if she really couldn't urinate. The hospitals have protocols like you have to empty your bladder within a certain amount of time or else they're going to have to do intervention. And so that was another learning curve for me to see that, kind of especially right after you deliver. You know, normally we're thinking like, oh, that's a time where you just leave it alone. Maybe you leave it alone if everything's healing properly and you can move your body.
Oh my God.
But like if you can't walk, that's a really big deal.
Yeah.
And again, as someone who worked in the hospital for a decade plus, if a patient comes in and they can't walk, they get physical therapy and a rolling walker standard. Standard. I couldn't walk after my daughter, and I knew better, but I didn't do a good job of speaking up for myself. She was in the NICU, and it was far. Now most hospitals have where mother baby surrounds NICU, which is glorious. I'll never forget, the nurse said to me, I think you should walk to the NICU because you're 2 days postpartum. And yeah, I was 2 days postpartum, but I delivered my baby at 4 a.m. So it was really like 30 hours postpartum, and I had a 2nd-degree tear. Like, my pelvic floor holds my pelvis together. Every time I put one foot in front of the other, it has to hold a load. So it was really painful for me to walk, and I should have asked for a wheelchair, and I didn't. And she said to me, most moms walk on their 2nd day.
Oh, God.
Not an assessment, not do you have a lot of pain, not what are your concerns with walking. Just most moms walk on their 2nd day.
And you're not.
And you're not. And I was like,
shame on you.
I was by myself. My baby was in the NICU. I was heartbroken. Like I didn't have a shred of strength to then speak up for myself. That little bit of pushback of like, nope, you're wrong. Toughen up. Like maybe she would have just given me a wheelchair if I had asked, but I didn't, you know? So anyways, postpartum is a thing. I really love to see these women early. When they've had a C-section, there's like a whole post-surgical protocol that we can take them through just to help them with basic things like rolling, like how to sit on the edge of the bed, which brace to put on. We do recommend wearing a brace for a little bit after a C-section. Just helps to offload that surgical site, that scar. We do specific arm strengthening so she can rely on her upper body and not have to use her core too much. Swelling management, oh my gosh, I have seen so many swollen bodies, pregnant and postpartum. That just complicates things unnecessarily. It really causes more things than we're aware of. And then for postpartum women after vaginal delivery, I mean, we can even spend more time talking to them about how to clean themselves after using the bathroom. Strategies with peri bottles and blotting and all the things. Helping them close the common birthing pattern in their pelvic bones. Because if you have any true or even perceived trauma during a delivery, your pelvic bones are going to stay open. They're like frozen. And so that puts a pull on your pelvic floor and that makes it hard to walk, makes it hard to move. So sometimes just gently closing that common birthing pattern, which is a phrase that one of my mentors, Lynn Schulte, taught us, it's a game changer. Like you can really shift the trajectory of your healing path.
Thank you for existing, because this is like, I'm so glad that more women would have access to this information. It's just fair.
Right. I agree.
And as someone who delivered 3 babies, all C-section is like, what? I can still have support after C-section.
Right.
And I've had friends that actually had vaginal births, and like they don't feel like they're in their body, or they feel uncomfortable, or like having uncomfortable conversations with their husbands, and like I'm not feeling right, or you know, thank you.